talk about the patient's attitude here in the United Kingdom. The patient is a broad umbrella, the one who is sick and the family as well. The attitude of the patients here is that they always want to be informed. They know their rights and they expect professionalism from all healthcare workers. So if they come to the hospital, whatever procedure has to be done needs to be explained very well. The nitty-gritty of all procedures, the advantages, the disadvantages, the side effects, the possible options available if that treatment is something that they think they have any reason to question what you are about to do. They want other alternative. They respect the healthcare system. Unlike in Ghana, where people go into the hospital and out of frustration because they are not informed, they try to find reason to blame healthcare professionals for what they are doing or what they didn't do. It all boils down to communication. A lot of patients in Ghana are not informed, and they are not well communicated to in terms of the procedures and processes. And so when they come, they have this perception about healthcare workers that they are so much suspicious. They have every reason to believe or mistrust the processes that they are going through. So sometimes other people are also shy. They just keep quiet and receive any treatment that you give them. That is not the situation here in the United Kingdom. People want to be informed, and in the situation where the person does not even have capacity to ask or inquire or to even understand the information that you are giving, you have to inform the lasting power of attorney for health, and finances. People designate people to take decisions for them when they think they are incapacitated in a way, or they don't have that reasoning ability to understand or make decisions. These people have to be involved, and people even go to the extent of registering with independent mental capacity advocates who would advocate for them in situations where they cannot speak for themselves. That is the attitude of patients and relatives here in the United Kingdom. Back in my country, Ghana, where I am from, a lot of people, only the minority of the patients who come in are well informed about the processes they are going through. People don't ask questions. They only come in and then receive what they are given, which is very bad. They become very shy, and they only know they have malaria. They don't know the treatment. They don't know how long it's going to take. This is one kind of behaviors that patients will put up. And people who have chronic conditions, some people have chronic conditions, you discharge them on medications, and they are easily convinced by family, they are easily convinced by outsiders that they can use alternative medicine to solve their problems. Here in the UK, adherence is very high. Patients adhere to treatment because they trust the system so much so well that there are nurses who would go back in the community into the homes of the patients, person who had diabetes, person who had hypertension, the person who even had a wound would have a follow-up from the tissue viability nurse, will have a follow-up from the community podiatrist, will have a follow-up from the community specialist, diabetic specialist, to follow up and see how well the patient is doing in the community. So the patient's attitude is that they are so much adherent to treatment, they respect the system, they trust the system, and they are well informed about whatever is happening with them. That is how far the patient's attitude here in the UK compared to that of Ghana.